Dear learners, in today's session on SDG and India's achievement, we are going to touch upon our India's national development programs, which were twin as per that SDGs goals, that is 17 goals. In this our progress during the last since its implementation of SDGs, right? In this first session, we are going to look into from SDGs goal 1 to SDG goal 9. Goal number 1 talk about no poverty, to end poverty in all its form, by everywhere by 2030. In India, looking on to our social structure and looking into our livelihood, dependent our livelihood system exists in our country, we need to strengthen agriculture, labor market to facilitate income growth, especially for the economically disadvantaged group of the society. And moreover, we need to have a social protection measures and mitigation of risks from natural and other disasters that ensure that unfortunate exigencies do not disrupt the poverty reduction effort. India is demonstrating a clear pro-poor pattern in this line at the subnational level. Now, if you look into progress, our poverty reduction in rural areas outpaced that in urban areas. So, two important sector approach government of our nation is following to achieve goal number 1, that is social protection first. Then when you talk about no poverty, it's directly related to basic services. So access to basic services is one of the approaches of our government of India. If we look into social protection, rural workers are protected against unemployment due to extent of at least 100 days of with employment per household in a year under Mahatma Gandhi National Rural Guarantee Act, MGNE, the Employment Guarantee Act. In addition to providing employment guarantee under Manrega, the program helps build up agriculture infrastructure and productive action, which improve rural livelihood opportunity. So this particular social protection scheme generated about 2.7 billion person days of employment during financial year 2018 to 2019, and 1 billion person days of employment so far during 1920. So a sizable number of these beneficiaries are women and from scheduled caste and scheduled tribe community, by accessing about 55%, 38% of person days of working generated during 2018-2019. Then, by following access to basic services, the government is giving access to a range of financial services, including banking, credit, insurance, and pension to vulnerable groups of communities. And that is provided under Pradhan Mantri Jan Dhan Yojana. Under this Yojana, as many as 377 million accounts have been opened with deposit of amount to Indian rupees 1,079 billion. And this Prime Minister Jan Dhan Yojana also enables direct benefit transfer to the accounts of beneficiaries and improve the effectiveness of social security provision. To strengthen the universalizing primary health care, so it is also initiated under Pradhan Mantri Jan Arogya Yojana program. Disadvantaged and vulnerable persons, including the elderly, widows, and persons with disabilities, they are able to access pension under the National Social Assistance Program. Access to housing is also very important. So it is one of the basic, when we talk about basic requirement, we talk about Roti Kapra Makan. So access to safe housing is also a very important component, and we ensure, the government ensure under this access to house under initiative of Housing for All by 2022. Then energy is also important. So access to electricity for all households in the country is also achieved under the Saubhagya scheme. So these are some of the schemes under which we can look under the SDG goal 1 to achieve SDG goal 1. The achievement so far, by implementing all these whatever that I mentioned, some of the new initiative by government of India, we are able to, if you look into poverty rate, if you look into some of the rate in 2011-12, as per Tendulkar committee, it was estimates that 21.9% of the Indian population lives below poverty line. 6 states and 6 union territories already achieved the nation target of reducing the poverty rate to below 10.95% by 2030. And Goa among the states and Andaman and Nicobar Island among the union territories have the lowest poverty rate of at 5.09% and 1% respectively. Health is very important component to end poverty. So health insurance coverage is also increasing from 28.7% of households have at least one member covered under a health insurance or healthcare scheme. The national target is to cover all the households in India by 2030. Then, as I mentioned that under Mahatma Gandhi National Rural Employment Guarantee Act 2005, it is also effectively utilizing across the country. Then, maternity benefit, that is also very important social security scheme. So 36.4% of the eligible beneficiaries receive social protection benefit under this maternity benefit as per NFIS. The national target is full coverage by 2030. Then we have achieved 4.2% of household. Looking into that household living in Kacha houses, among the states in Union Territory, the highest percentage of household living in Kacha houses in Arunachal 29%, Jammu and Kashmir 4.3% respectively. None of the households are living in Kacha house in the Union Territories of Andaman and Nicobar Island, Chandigarh and Lakshadweep. The next goal number 2, zero hunger. With a nearly 6-fold increase in food grain production from 50 million tons in 1950-51 to more than 283.37 million tons in 2018-19, India has done well to expand food production and build up stock of food grains. Access to subsidized food has been met an entitlement and an incrementally efficient public distribution system that enables to access food grains far and wide in the country. A special initiative has been taken to ensure access to food of vulnerable section of the people. Given the fact that 70% of rural Indian households are dependent on agriculture and improved food availability is the basis for sustainable access, innovative initiatives are being introduced to modernize the agriculture and erase negative impacts of especially the climate change. The L process followed by Government of India is to have food and nutrition security, then to increase agricultural productivity and agricultural income, and buying a country which is run by agriculture as an important profession. So climate adaptive agriculture and sustainability is one of the important approaches we are following. Under food and nutrition security, we have public distribution system under the National Food Security Act, and which is a paradigm shift in the approach towards the issue of food security at household level from welfare to a right-based approach. And this NFSA adopts a life cycle approach, making special provision for ensuring food security of pregnant women, lactating mothers, and children from 6 months to 14 years of age. Under the Antyodaya Anna Yojana, AAY, the poorest from amongst the below poverty lines families are entitled to 35 kg of food grains per month at more subsidized rates. Then school-going children is giving food midday meal under the midday scheme, which is provided nutritious cooked midday meal with a calorie range of 450 to 7,000 to over 120 million children at primary and upper primary school. Then we have the National Nutrition Mission at Poshan Abhiyan also that make a concerted attack on undernutrition, stunting and anemia. If we look from agricultural productivity and income point of view, we have a scheme like Pradhan Mantri Krishi Sinchai Yojana, PM KSY, that focuses on improved water efficiency with the motto of Har Khet Ko Pani, per drop more crops, and provided end-to-end solution in the irrigation supply chain, based water resources, distribution network, and farm level application. Then we have the Pradhan Mantri Fasal Bima Yojana that provides better insurance coverage and agricultural credit at a reduced rate of 4% per annum to farmers. The Pradhan Mantri Kisan scheme, which was initiated, that extend payment of Indian rupees 6,000 per year to every farmer in the country, that provides a further boost to their income. Then under the scheme, Pradhan Mantri Kisan Sampada Yojana, then financing of mega food infrastructure of agro-processing clusters, integrated cold chain and a value addition infrastructure are undertaken in addition to other components. So in the era of climate adaptive agriculture and sustainability, we have the National Mission for Sustainable Agriculture, and in tandem with other missions under the National Action Plan on Climate Change, that addresses the climate risks and aims to increase agricultural productivity, especially in rain-fed areas, focusing on integrated farming, soil health management, and synergizing resource conservation. We have a National Innovation in Climate Resilient Agriculture Scheme, that climate resilient technology demonstration, which was implemented in 151 climatically vulnerable districts, which aims to enhance farmers' adaptive capacity and skills of resilient climate agriculture. And district agriculture contingency plan have been prepared for as many as 648 districts to adapt agriculture to adverse weather conditions. By adopting such kind of schemes, and we can look into what is our performance. When you talk about, then if you look, for example, in that performance, we can look into food subsidy. Then in food subsidy, every rural household where the monthly income of the highest earning member is less than Indian rupees 5,000 as per socioeconomic caste census 2011 is covered under PDS, public distribution system. And Manipur among the states and Delhi among the union territories have recorded best performance of this indicator at 1.36 and 1.29 respectively. Looking into anemia among women, the target for 2025 for the nation has been set at 25.15%, and Kerala and Sikkim are the only states in India to have reduced this rate to below the target. Anemia among children, 40.5% children aged 6 to 59 months are anemia in India, 40.5%. The aim of the government of India is to reduce from 40.5% to 14% by 2030. And we are progressing well, especially 3 states, Nagaland, and Manipur, and Kerala, they have already crossed the set target, with children anemia rates of 8, 10, and 12.5% respectively. Agricultural productivity. Indian agricultural produce 2,516.67 kg of agricultural produce of rice, wheat, and coarse cereal from 1 hectare of land annually. The target is to double this by 2030 to 5,033.34 kg per hectare. Punjab and Andhra Pradesh are nearing this target with current level of 4,169.67 kg per hectare and 3,917.50 kg per hectare respectively. Again, if we look into the gross value added GBA in agriculture, Indian rupees 0.68 lakh is the gross value added in agriculture per worker currently. The target at GBA in agriculture per worker is set 1.36 lakhs in accordance with UN target 2.3. Goa with a GBA in agriculture per worker is at 3.7 lakh, Punjab at 2.4 lakhs, and Kerala at 2.19 lakh, leading performance. And Union Territories, Andaman Nicobar with 2.98, Chandigarh 2.78, and Delhi 2.35 lakhs respectively. The goal number 3, good health and well-being, ensuring healthy lives and promote well-being for all at all ages. Let us see what is our approach. So, the extent of change and improvement in India's healthcare system over the past decade is very remarkable. We will see we are progressing very well. There have been significant shifts in health strategy adopted and new direction set. Our emphasis is on water and sanitation, primarily through Swachh Bharat mission. It has a considerable impact on the spread of communicable diseases. The National Food Security Act and the well-targeted National Nutrition Mission and Poshan Abhiyan. Again, technology is leveraged for improving the efficiency of the health management system, EVIN, Electronic Vaccine Intelligence Network, to track and improve immunization cover, then ANMOL, ANM online, to extend better maternal and newborn care service and use of artificial intelligence to improve diagnostic and the treatment. To achieve this goal number 3, good health and well-being, the basic important component which India is looking is reducing maternity mortality rate, reducing under 5 mortality, addressing the burden of communicable disease, adopting a focused approach for non-communicable diseases, NCDs, ensuring universal health coverage. So through these approaches to reduce maternity mortality ratio, we are implementing the reproductive, maternal, newborn, child and the adolescent health strategy. And we have had a profound impact on the maternal health situation because of this approach. To reduce under 5 mortality, we have universalized immunization approach under the mission Indradhanush and aims to immunize by 2030. To address the burden of communicable disease, the government has recognized the burden of this communicable disease, and we have been working to eradicate them through several targeted programs, such as we have NACP, National AIDS Control Program, the revised National Tuberculosis Control Program, RNTCP, and the National Vector-Borne Disease Control Program. To adopt a focused approach for non-communicable disease, we have National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease, and Strokes, NPCDCS, the National Multi-Sectoral Action Plan for Prevention and Control of NCDs that provide clear direction for tackling the growing burden of NCDs in the Indian socio-economic, cultural, and health system context. Under the Mental Health Care Act 2017, it has an entitlement approach to the delivery of mental health care and services. Ensuring universal health coverage is one of the key approaches to achieve goal number 3. Under this, to achieve this, we have Pradhan Mantri Jan Arogya Yojana with 2 basic components, Ayushman Bharat and Health and Wellness Center in 2018. This Ayushman Bharat targets to provide health insurance coverage to over 100 million poor and vulnerable families, approximately 500 million individuals, up to Indian rupees 5 lakhs per family per year for secondary tertiary institutional care. If we look into the achievements so far under this goal, our maternal mortality ratio stands at 122 per 1 lakh live births. The UN target is to reduce it to 70 per 1 lakh live birth by 2030. So we already 70 per. So indeed, 3 states, Kerala, Maharashtra and Tamil Nadu, have achieved this target with MMR, maternal mortality ratio of 42, 55 and 63 respectively. In institutional deliveries, approximately 54.7% of estimated deliveries happen in a health institution in India. The target is to increase it to 100%. We have to go. So Kerala is the best performing state with 74% institutional delivery. Among union territories, Chandigarh and Puducherry have achieved the target of 100%. Under 5 mortality rate, you will see for every 1,000 live birth in India, 50 children die before completing 5 years of age, according to NFHS 4. UN target is to bring down to 25 per 1,000 live birth. So under this, Kerala and Goa among the states and Andaman and Nicobar Island and Pondicherry among the union territories have already achieved this target. The highest under 5 mortality rate in Uttar Pradesh is 78. Then if we look into immunization coverage in children, the 75th round of the National Sample Survey observed that 59.2% of children in India in the age group of 0 to 5 years are fully immunized. 1 dose of BCG, 3 doses of DPT and OPV, oral polio vaccine, and 1 dose of measles vaccine. The national target is to increase 100%. Manipur is the best performing state with more than 75% of children in the age group of 0 to 5 years fully immunized. In case of tuberculosis, about 160 cases of tuberculosis per 1 lakh person were noted in 2018. The target is set to 0 cases noted, implying that the incidence of tuberculosis in the country needs to be eliminated. Among the states, the lowest incidence is noted in Tripura with only 66 cases. And Lakshadweep among the union territory is on the top with 29 cases per 1 lakh population. And if we look into HIV incidence, it is per 1,000 infected population is estimated to have declined from 0.64 in 1995 to 0.07 in 2017. At 0.01, Himachal Pradesh is closest to achieving the UN target of zero HIV incidents. Jammu and Kashmir lead among the union territories with incidents of 0.02. And if we are looking from family planning, around 47.8% of currently married women aged that is between 15 to 49 years use modern methods of family planning. UN target is 100%. So in Andhra Pradesh with 69.4% is the highest state in India. And among the union territories, Puducherry with percentage indicator of 61.2%. Goal number 4, quality education. Ensuring inclusive and quality education for all and promote lifelong learning. And we talk about education. India's basic objective is free, equitable and quality primary and secondary education. Access to quality early childhood development, care and pre-primary education, accessible, affordable and quality higher education, skill development and economic growth, conducive educational facilities that are child, disabled and gender sensitive. So in this line, our country's initiative under free, equitable and quality primary and secondary education is we have centrally sponsored scheme of Samagra Shiksha that envisages the school as a continuum for preschool, primary, upper primary, secondary to senior secondary level. This scheme subsumes the 3 schemes of Sarva Shiksha Abhiyan, SSA, Rashtriya Madhyamik Shiksha Abhiyan and teachers education. The primary objective of these schemes are the provision of quality education, enhancing learning outcomes of students, bridging social and gender gaps in school education through equity and inclusion, promoting vocationalization of education and supporting the state's implementation of right of children to free and compulsory education, means Right to Education Act 2009. Access to quality early childhood development, care and pre-primary education. Early childhood care and education, it is very essential foundation for lifelong development and learning, which have a lasting impact on early childhood development. The Integrated Child Development Service ICDS scheme offers a package of 6 services: supplementary nutrition, preschool non-formal education, nutrition and health education, immunization, health checkup and referral services for children and in the age group of 0 to 6 years, pregnant women and lactating mothers. So accessible, affordable and quality higher education. In this line, the consistent efforts are made to expand the formal base of higher education with a particular focus on technical, professional, vocational education. So total enrollment in higher education is estimated to be 37.4 million with 19.2 million boys and 18.2 million girls. And girls constitute 48.6% of the total enrollment. Gross enrollment ratio in higher education in India is 26.3% for 18 to 23 years of age group. Skill development and economic growth. The flagship scheme of Pradhan Mantri Kaushal Vikas Yojana supports youths in taking up industry-relevant skill training to secure a better livelihood. Under conducive educational facilities that are child, disabled, gender sensitive, we have that several schemes that increase girls' child education, such as Beti Bachao, Beti Padhao scheme, and then we are promoting educational facilities that are sensitive to the needs of disabled children, that ensure an inclusive learning environment for all. We had Swasth Vidyalayas that separate toilets for girls that help to address female dropouts to considerable extent. If we look into the progress, in case of enrollment ratio, the adjusted enrollment ratio in 2019-20 is from class 1 to 8, and that is elementary, elementary and secondary, that is class 9 to 10. The adjusted enrollment ratio in India is 75.83. Among the states, Tripura has the highest enrollment ratio of 94.72, while Delhi has led the Union Territories with 92.95. Children out of school. Goa is the best performing state with no child in the age group of 6 to 13 years out of school. Pondicherry performed the best among Union Territories with an impressive figure of 0.18%. If we look into the average annual dropout, The dropout rate at the secondary level is 19.89%, with Himachal Pradesh performing the best among states with 7.0% and Chandigarh among union territories with 0. Enrollment ratio in higher education according to AISIG report to 2018 and 19, 26.3% of students in the age group of 18 to 23 years are enrolled in higher education. The target is to increase it to 50% by 2030. Sikkim among the states and Chandigarh among the union territories have the highest enrollment ratio at 53.9% and 50.6% respectively.